you want to come over, Michael? Do you want to come over? All right, thanks very much, everyone, and thank you for joining us at Dome here in Maylands. And we've got with us Nigel Oakey, who, as you'll be aware, is runs and operates the Dome Group, but also the Mill Hotel in Katanning and the Farmers Home Hotel in Northam, amongst many others. So he's here to comment as well. Can I firstly thank the firefighters who've been out there dealing with the fires both in Martin, the suburb of Martin, and also Kirrup in the southwest. It's obviously been a very difficult period. I understand they've done a wonderful job, and I'd like to thank each and every one of them for all of their work. In relation to COVID, overnight, Western Australia recorded 29 new cases. This includes 17 new local cases, 11 interstate travel-related cases, and 1 overseas travel-related case. Of the 17 local cases, 15 are linked to current outbreaks, 2 are still being investigated. In today's new local cases, it includes a teacher at Winterfold Primary School in Beaconsfield. 7,764 tests were conducted yesterday. As of Monday, the proof of vaccination became mandatory statewide at a large number of venues. Double-dose proof of vaccination for those aged 16 and older will be required for visitors to public and private hospitals and aged care facilities, all hospitality venues, including restaurants, cafes, bars, pubs, clubs, taverns, nightclubs and dine-in fast food, roadhouses, service stations and takeaway is exempt. Indoor entertainment venues, going back to the compulsory ones, indoor entertainment venues, including play centres, gaming and gambling, theatres, concert halls, museums, cinemas and live music venues, bottle shops, the entire Crown Perth complex, major stadia, gyms, fitness centres and health studios, amusement parks and the zoo, and music festivals and large events with more than 500 people unless exempt. As at 8 a.m. this morning, there have been 674,263 registrations on the Service WA app. I'd like to encourage everyone also to be polite and respectful when visiting premises that require proof of vaccination. We're rolling out a public assistance resources to people in relation to the Service WA app with hard copy booklets and one-on-one assistance. That's happening at libraries, shopping centres and train stations. On Monday, the crew at Vaccination Forum saw around 30 sit-down guests to explain Service WA. There are also a number of queries and people just taking the step-by-step guide, which is available. Yesterday, they were doing the same thing in Bunbury. Around 1,200 booklets were distributed across Perth, Perth Underground, Mandurah and Joondalup train stations on Monday. The number of check-ins yesterday at premises was 2,006,390. But we need to keep it up, keep downloading the app and also use the check-in codes. In February, we will launch a vaccination blitz to drive up our third dose rates even higher. An extra 40,000 appointments will be made available at state-run clinics over 2 weeks from Monday, February 7. That takes our total capacity at state-run clinics to around 100,000 appointments per week. Western Australia's first dose vaccination rate for those aged 12 and older is now more than 97.4%. And our double dose vaccination rate is now more than 91.9%. Of Western Australia's 16 and over, 37.6% have received a third dose. This year, our third dose vaccination rate has been increasing by around 1% per day. About 1.2 million West Australians are currently eligible for a third dose vaccination. By coming forward to get vaccinated, you can help further protect yourself, local businesses and the economy and jobs. It's worth noting there's encouraging economic data that has been released. ComSec's State of the State report shows that Western Australia recorded the strongest employment growth and the fastest nominal economic growth in the country. Economic activity over the year to September 2021 was 37.7% above its normal or decade average level of output, according to CommSec. ANZ credit card data has shown Western Australia's credit card spending is the strongest of the states. Credit card data is important as it's one of the measures that gives you near real-time insight into retail spending. It also shows the devastation of COVID caseloads on retail, hospitality and tourism numbers in the eastern states. It's important that we retain consumer confidence. Consumers having the confidence to get out of the house and spend is clearly going to be higher when they're not worried about bringing the virus home. Can I thank you all? I'll hand over to the Minister for Education.
Thanks very much, Premier, and good morning, everybody. Can I begin by commending the leadership and the staff of Winterfold Primary School for their professionalism in dealing with the current situation. I spoke with the principal late yesterday afternoon, and I know that he leads a strong and engaged school community who will support each other. It has been an unsettling period since yesterday afternoon for that school community, for their children, for their families and the staff, and I want to reassure them that all of the arrangements and protocols that needed to be in place and to be followed were, and that arrangements are in place to return to safe learning at Winterfold Primary School from tomorrow for those not quarantined. You'll recall last week when I was asked about school returning this week, I said that the current settings would apply and that in the event there was a positive case, the Chief Health Officer would consider the particular circumstances. The particular circumstances here include that the positive case attended a whole school staff professional development day on Friday the 28th of January and then the Room 11 classroom on Monday the 31st of January. Whole school staff days, professional development days, don't happen every day and they don't happen every week. There are around about 55 staff who attended that professional development day and 27 students in that classroom on Monday, and they are quarantined for 14 days. So for staff who attended that professional development session, it's 14 days since Friday, and for the students who attended the classroom on Monday, it's 14 days from Monday. In line with our commitment to maximise face-to-face learning, the school will reopen tomorrow for the rest of the students. There will be replacement staff, so for the next 14 days there will be different teachers and other staff than the children are used to, but normal face-to-face learning will resume. I said last week that we had plans in place both to fill all positions on day one and also in the event that we needed to replace staff who were absent due to COVID-19. And those arrangements are in place and have been initiated. In each region, we have a pool of staff identified who can immediately step in. The department also has casual and relief pools, and in addition to that, there are 515 registered teachers in the department ready to be deployed as required. For teaching and learning, the quarantined Year 3-4 class will be provided with home learning packs in the first instance. Winterfold Primary School does have online teaching and learning plans in place, and they will be enacted as required over the 14 days. Students will be returning to Winterfold Primary School tomorrow to continue face-to-face learning to ensure that we minimise the disruption to schools that occurs in an outbreak of COVID-19. Can I end my comments where I began? Thank the leadership, the staff, the families and the students at Winterfold Primary School for the way they've conducted themselves to date and the way that I know they will conduct themselves over the next 14 days. Now, I'm happy, what I might do is hand over to Nigel and then I'll come back to take questions when you want.
Hello, I'm happy to take any questions that you might wish to make in relation to the Service WA app or business issues or anything that's affecting, businesses at the moment. It's a really dynamic time and it's a challenging time. But so, any questions?
Have you had any of your staff abused?
any of my staff.
Have they been abused?
We've had in a few locations customers not being aware that it started at the start of the week and getting a little bit confused and maybe bordering on irate, but actually on lots of those occasions they actually had the proof of vaccination with them and their ID. So I think what we're doing is coaching a lot of guests to realise if you haven't yet got Service WA, and there are pathways to do that, there are other ways to actually provide that proof of vaccination. So you can skin the cat a few ways here in the interim whilst you get your local 16-year-old to get the app sorted out for you or follow the new guide.
Have you had to run any extra staff to check all these vaccinations and IDs and apps?
Yeah, look, the way the regulations work sensibly is they recognise that there are different business models. And some venues, for example, have manned entries. So if you have a manned entry with a security guard, if you're a nightclub or a pub, then you can naturally check at that point. Lots of cafes, this one you've seen, has 4 entrances, so the ability to man all those entrances and check isn't there. So the regulations say check the vaccination at the first practicable point. And for us, that's when someone comes to the till and makes an order, and that's where we're doing that check on each and every occasion.
How sustainable is the 14-day isolation period for your businesses?
Well, we've yet to cross that bridge. My observation from Western Australia is that if you're getting lots of staff with extremely high caseloads in the sort of situation that we've seen over east, that's when it becomes really difficult. I would imagine that if you're managing low caseloads and you have isolated isolations, that's a much better position to be in. And that's, I imagine, what we're all hoping for in Western Australia, is to actually have much more of a dynamic suppression. You know, maybe COVID zero's out the door, but dynamic suppression that just doesn't let it get away from us. Because what we and my industry colleagues have seen on the eastern states is disaster, and that's when it would get very challenging, and in fact the whole of society starts to become dysfunctional at that point.
Are you having any staffing issues though, like are you trying to fill job vacancies?
Yeah, I mean, story of WA, story of Australia, story of the world actually, if you look out, is this is something that the pandemic has delivered up to everyone globally. So yes, we are having staff challenges. We are having some stores that have had to reduce trading hours. Up in the northwest, where we've got the mining industry competing for labour, you know, we've had to close a store for a period. Now, some people have said to me, well, why don't you get aggro about that, and the reopening might solve it. My observation, and I think it's not really a matter of conjecture, my observation is that reopening would have made it a whole lot worse, and that's what they've experienced. So how do we get out of that? That's the million-dollar question. I think we're all stuck with those challenges for a while, and it's not going to be easy.
When would you like to see the border be reopened?
I would. How would I answer that question? I think the idea now of just saying, and this is just my personal view, arbitrarily sticking to a new date because it's a date makes no sense whatsoever. The virus isn't working to a new date. The current version of the virus is Omicron, and it's playing out its own agenda, which says if you don't get 3 jabs, we're going to hurt you. So I imagine that's the first port of call. At what point can we get that critical mass of 3 jabs? I think what the virus is also saying is that this will keep going. There will be new variants. And so how in the future can we in Western Australia have a measure which provides, I don't know, some sort of forward defence or a radar to make sure that we can see fresh danger coming? That would be my personal hope. I feel sorry for my colleagues over east now, because they've pulled the paddock fence down, they've pulled the gate down, and everyone's standing there and it's now put personal responsibility. I think we can already see that's been a massive mistake. And I don't know, what do they call it? Shaking and baking? We might end up with a bit of shaking. I don't want to be baked, right? So that is my hope, that we can use the hindsight of the East Coast to develop a different foresight for Western Australia. No pressure, Premier, but that would be the hope, that we can actually look at the disaster and say, well, why would we repeat it? And if you look at all the industry associations in my game, they are now screaming for support. It's costing Sydney $1 billion a week, and that's not going to touch the sides. So it just ends up being bad for everyone. And it's not good. You know, people want the border to be open. I want my freedom back. We all want our freedom back. But the virus is setting the rules here, not me, not the government. And I think agility and being flexible and making sure we can keep changing and being dynamic, that's what I would like to see as a business owner.
Any questions? Yes. Minister, you said that the schools will be the last to close, first open, last to close, face-to-face learning with priority. But you also said the CHO could shut down a school whenever they decided to. Which one is it, and how can you give parents any certainty?
What I said last week was that when school opens, which is this week, the current settings would apply. That's the 14 days quarantine, and that's what's happened. I also said we want to maximise face-to-face learning. So for practical purposes, Winterfold Primary School has closed for 1 day to enable the cleaning to be done and for the replacement staff to be stood up. So as I said, the particular circumstances here are that the whole of the teaching staff attended the professional development day on Friday. That doesn't happen every day. So the particular circumstances here are that we need to stand up a significant number of the staff, so replace a significant number of the staff, and it's taken us 1 day to do that.
Has every teacher been wiped out from that school then by this?
Those that attended the professional development day on Friday, which I expect is the vast majority, there might be one or two that didn't.
Is that sustainable though? Wouldn't you assume that teachers would gather in the staff room in a normal day? And so you have every time the school has to shut down, you have a significant number of teachers taking up the 2 weeks.
So under the current settings, the current arrangements apply, and that the particular circumstances are taken into account. What was different here to a normal day at school where people go into the staff room, for example, for short periods of time, and then not all at the same time? What was different here was that all of the staff, the teaching staff, gathered in one space to do that professional development program. That doesn't happen every day. That's the particular circumstances that apply to this particular school.
So it's unlikely in the future that we'll see a school be shut down in response to one teacher or no students.
As I said last week, under the current settings, the CHO, the Chief Health Officer, will look at the particular circumstances. The particular circumstances here don't occur every week. So I would anticipate we wouldn't be doing this every time, but frankly, I can't give you that commitment because it is literally going to depend on the circumstances. But the overriding principle here is face-to-face learning is best. To the extent that we need to quarantine or close down part of a school, that will be the preference so that we can maintain maximum face-to-face learning.
The new rules come in when there's a high caseload. If there are further disruptions to school and there isn't an issue standing up more staff, would you advocate for the new rules to be brought into schools and to primary education sooner than the rest of the population?
You can appreciate that an awful lot of planning went into making the announcements that we made last week. So the Department of Education has done an awful lot of work on making sure, and I said this last week, not only were we ready to fill vacancies for day one, but we were ready to fill vacancies created by absenteeism whenever that occurred. And so we are ready, and we have dealt with the situation at Winterfold Primary School according to the plans, and we will replace those staff ready for school tomorrow.
When will those settings change, Minister? When will those settings change?
I think you know the answer to that. When the Chief Health Officer provides advice, and as the Premier and the Chief Health Officer set out last week, that will be based on a combination of factors, not just high caseloads, but also whether there are linkages between those cases. And the Chief Health Officer will provide advice to the government about that.
So does the Chief Health Officer take into consideration those calls from a growing number of sectors for those settings to change?
The Chief Health Officer takes into account all of the factors. They include the health like the medical, the epidemiology, the social and the economic. That's what public health policy is, and the Chief Health Officer balances all of those things with every decision he makes.
Why can't you get those kids back into the class as soon as they test negative for that, and then they don't miss 2 weeks of testing?
Sure. So the current settings apply, and the current settings where we have low cases in the community is that PCR tests are the best. That's the gold standard, and that the 14 days quarantine is the current setting.
Do the new settings come in, sorry, just to clarify, do the new settings come in when we reach high caseloads or very high caseloads?
So I'm pretty sure you were at the media events last week that I was at, when the Premier and the Chief Health Officer made clear that there are a number of factors that the Chief Health Officer will take into account when providing government advice as to when those new settings kick in.
So that there's 2 different classifications. It's confusing, but there's a high caseload where close contact isolation is changed. And then when we reach very high caseloads, there are further isolation sessions of people working in essential industries.
Yes.
So is it when we reach high caseloads or very high caseloads that school rules change?
So the Chief Health Officer will provide advice about what we need to do at each level. There are plans in place to scale up and to scale up again if we need to, and I outlined and gave some examples of those last week. For example, it might include where you can separating groups of students and year groups, so they only use one part of the school campus and another group of year groups use another part. You kind of keep them separate. All of those plans are in place, ready to step up when the Chief Health Officer provides that advice.
So there's no certainty for parents then about when that's going to happen. So how many weeks is it going to be 14 days?
There is absolute certainty for parents that schools have put in place every measure possible to do 2 things: to keep students and staff safe and to continue face-to-face learning. As to more precise than that, the nature of the pandemic, the nature of the virus is that things are not neat. The virus does not follow what is convenient for the rest of us. We have to make plans, put them in place, be agile and flexible and ready to scale up when we need to. Parents can be assured schools will continue to be places that are safe and places where we maximise face-to-face learning.
Your comment though that the schools will be the first to open and the last to close, what does that actually mean?
It means we're going to do everything in our power to continue face-to-face learning. So in this particular circumstance, where we had the professional development day, that is why a large number, the majority of the teaching staff, need to be replaced. This isn't going to happen every week because we don't have that particular circumstance every week. We want to maximise learning. So if you take your minds back to the closures that we had of the 3 schools, I think it was end of second term, maybe beginning of second term last year, there were 3 schools that were closed for the entire period. Now, with the principles that are in place now to maximise face-to-face learning, where we don't have to close an entire school, we won't. But in this particular circumstance, because they were all at the one professional development event, we've had to do it for 1 day.
So should professional development days be banned and done on FaceTime? I mean, why are big groups of teachers gathering in a small space when it's going to lead to 14 days of quarantine?
The current settings are such that masks were worn, all of those measures were in place. The virus, though, doesn't appreciate the inconvenience that it causes. The current arrangements are such that 14 days quarantine is required. When the settings change and we're able to put in place the next level of measures, that's what we'll do.
Do all of the household contacts of those 55 staff, 27 students have to be in isolation for 14 days also?
So with the staff, it's the isolation in their household. If they can manage 2 separate bathrooms, they'll need to take that into account. With the students, though, it is likely to be, depending on the layout of the house and the household arrangements, they might be able to arrange that one parent can be in one part of the house with the child, while the rest of the the rest of the family is in another part of the house. But it will depend on the particular circumstances of the family and the house.
So there's cases where the parents will have to isolate alongside their children if it's a small house.
Well, if you think about this, these children are 8 and 9. You wouldn't want a child quarantining by themselves, would you? I guess I reiterate the point. These current settings are no different to what they were last year when we had to close 3 schools and people had to go into quarantine. It's no different, and it is inconvenient.
But you know that you're going to go to the 7-day quarantine period. So at the present time, you're doubling parents and family pain by sticking to this rigidity of a 14-day setting.
What we have to do, Jeff, is follow the Chief Health Officer's advice.
Well, no, you can show a bit of leadership and start making decisions, because you know you're going to go to 7 days. You know it.
The leadership is having the plans in place and the commitment to continuing face-to-face learning and maximising face-to-face learning. We've made tough decisions. We'll make them again.
Yeah, I know,
but we
come back to this. You know you're going to go to 7 days. Everyone is calling for it. Industry's calling for it. Mining's calling for it. You know you're going to go there. Why stick to 14 days now? Why don't you give some clarity to industry and these other sectors about what you're going to do?
There is clarity. I said it. There is. I said it last week that the current settings apply, and the current settings, based on the Chief Health Officer's advice, are 14 days. There are a range of criteria that the Chief Health Officer will take into account in determining whether, when we move to the alternate settings. I know that it's inconvenient and that it's uncertain. Nothing in this pandemic and the way that the virus has conducted itself is neat or easy. We have made the best decisions based on the best health advice each time, and we'll continue to do that. The position we're in now, that we weren't in last year, is that we recognise what we learnt from the East Coast was that constant having kids at home instead and closing whole schools to reduce the kind of social contact and the learning for students is no good for those students. And so, in this case, Winterfold Primary School will open for all of the rest of those students tomorrow.
How's the school start? If you keep closing schools and the teachers have to go home for 14 days, how many relief staff do you have? What if 100 schools have to close tomorrow and teachers have to go home for 2 weeks?
With the greatest of respect, if 100 schools had to close tomorrow, I'm suggesting to you we would have high cases in the community and we would be moving to the alternate settings. These arrangements are in place, have been subject to extensive planning, as you might imagine. I'd already made the point, we have a pool of, I think it's around 4,000 casual teachers. In addition to that, another 500 in the respective kind of head offices, regional offices, and we have regionally based, locally based pools of teachers. We'll do what we need to do to maximise face-to-face learning, whatever the setting.
How many teachers did you end up releasing as a result of the vaccine mandate?
I think it was combined teachers and education assistants. I think it was around 130, Josh, but I'll confirm that number. I just don't have it with me.
And isn't the difference between now and last year also that we're now 92% double vaccinated and we have rapid antigen tests that are legal as a testing method? Surely we can come to a solution where we don't have to take kids out of school for 14 days.
So the Chief Health Officer's advice is that when while the current low numbers of cases are in the community, that PCR testing is the preferred model, and that RAT testing becomes most effective as a tool when you've got high caseloads.
Is the reason that you refuse to budge for 14 days at the present time because you don't have RAT testing and not RAT testing?
No. There are millions. I'm sorry, I don't have the number. There are millions of RAT tests available. I just reiterate the point, and I said this last week. If there was to be an outbreak in a school this week, the current settings would apply.
Next week.
Right, any questions for me?
A lot of calls, Premier, for you to change those settings. When would you try? I know you're going to say health advice, but are you deaf to the appeals of industry and various other sectors to change those settings?
Look, it won't be far away, but just so you understand, the 14 days is safer. It ensures we have less spread of the virus in Western Australia. It allows us to get our vaccination rate up, our third dose vaccination rate up, without greater community spread of the virus. So in other words, the existing arrangements are there to save lives and at the same time save jobs. The more spread of the virus you get, as you've seen in the eastern states, the more things close. So I've been reading reports every day about the CBD in Melbourne, the CBD in Sydney. Lots and lots of businesses closed, lots of decline in retail trade, lots of decline in foot traffic. If you go to the new rules more quickly, what you see occur is greater spread of the virus more quickly, and I don't think that is well understood. That's why we're sticking with the existing rules at the moment, but as we get more spread of the virus, obviously we'll then need to move to the new rules. And the new rules are designed for a higher caseload environment.
What about changing specifically for, say, mining, oil, gas? I mean, they're experts, have been experts at controlling COVID over the last couple of years. They've got all the experience, they've got plenty of rat tests. For that sector alone, would you consider moving immediately?
Over the course of the last 2 years, everything we've done has kept that sector open. Most successful in the world. Most successful in the world. You have a look at other mining sectors, oil and gas sectors in other parts of the world, lots of them have suffered grievously. They've had to close mines, they've had to close parts of it. If you have a look at other parts of Australia, that's what's occurred. So the measures we put in place have been based upon being cautious and conservative. It kept that industry open. Now, at the moment, there's been really no disruption to that industry. At the point in time we need to change the rules, we will, and we'll continue to work with and listen to the industry in the lead up to that point in time. Now, I know you all want a formula, you all want an exact date, you all want those sorts of things, but as we know with COVID, nothing is certain. Just want to quote to you what the Prime Minister said yesterday, and he said this at National Cabinet. He said this at National Cabinet to all of us, and you know, it's very, Omicron is very different. And what the Prime Minister said yesterday was this, and I quote, "A new and completely different strain of the virus like Omicron has come and changed all the rules. The unprecedented surge in cases caused by Omicron changed everything. It was like dealing with a completely new virus." So in other words, because of its transmissibility, because of its hospitalisation rate, because of its death rate, and we saw over east yesterday, 25 people die in Victoria, 16 people die in Queensland, 27 people die in New South Wales, and potentially other people have died in other states as well. We know that Omicron has been different, and that's why we had to change our approach, because we wanted to save lives and at the same time we wanted to save jobs.
So will you change isolation periods and close contact rules for specific industries, or will it just be blanket?
Yeah, as I announced last Friday, I announced all this at length. The expectation is we'll bring in a new set of rules across the community. But as I also said, there may be specific instances where you need to do a specific thing for a crucial industry, a crucial part of an industry, and we have communications with major sectors of the economy to make sure if those cases are required, we can do it. But just so we all understand, when we move to the new rules, that will enhance the spread of the virus in Western Australia. That will mean more people get infected, it will mean less retail trade, it will mean all those sorts of things. That's what will occur. But we know at some point in time we need to do it, because otherwise we have too greater levels of what's called furloughing and people staying away from work and absenteeism. In other states with these new rules, I was talking to a major mining industry the other day, they were telling me they have 20% absenteeism, 20% in their mines. Now we don't have that at the moment. We don't have that. So the rules we put in place have prevented Western Australia getting into that position the other states are in, whilst we get the third dose vaccination rate up. By getting the third dose vaccination rate up, we will save hundreds of West Australian lives. I actually think that's important. That's important. Saving hundreds of West Australian lives, whilst we save thousands of jobs in the interim and reduce the impact of Omicron on lives, hospitalisation, and also the broader community through jobs and the like, is actually important. and everything we've put in place has been designed to that purpose. Now, in Victoria, they've had schools over the course of the last 2 years closed for months. All their schools, thousands of schools, closed. That's what's occurred in Victoria. New South Wales has been through similar experiences. Over the course of the last 2 years, we lost, I think it was 4 days teaching, 4 or 5 days of teaching. We've had schools you could count on one hand closed over the course of the last 2 years because we've been cautious and conservative. And I think being cautious and conservative works, particularly in light of what the Prime Minister said yesterday.
What the Prime Minister said yesterday specifically in relation to PCR testing, to lab testing. I don't think it was making a broad commentary about
If you don't think Omicron changed everything on Delta, you've got rocks in your head. What happened with Delta is the spread of the virus was low and the hospitalisation was low. Omicron meant the spread of the virus was massive and the hospitalisation rates climbed by up to 900% in the eastern states. And then the death rate went through the roof and people being sick went through the roof. And the furloughing, the absenteeism, the number of people basically not going out of their homes, the self-imposed lockdowns, went through the roof in the eastern states. It's staring us all in the face. And as I said, back on December 13, which I'm going to remind you all of again, when I announced the date, I said subject to there not being a catastrophe or emergency. Obviously, thousands of people dying in the east is a catastrophe and an emergency. And so we have done exactly what I foreshadowed back in December.
The opposition are saying that based on a report by the Chief Health Officer, opening at any point after March 5th would be more detrimental to the lives of Western Australians. Is that what you say?
Look, the opposition, the Nationals and Liberals and Nationals, they've just continued to undermine the whole way through. We'll do what we do based upon the best of health advice and the best interests of Western Australia. Not going to be railroaded by the Liberals and Nationals that back Clive Palmer. Look, which bit, Jeff?
Well, about that it would be detrimental, according to the Chief Health Officer, to if we open up any later than March 5th.
Look, the letter was published. I don't think that was the exact wording that the Chief Health Officer used, and was published and given to you all last week, I think. But obviously, as you go along, we'll continue to monitor the situation and adopt the best health measures, which incidentally also result in the best economic outcomes.
So if you're on a booster dose now of 37% and it's 1% a day, will you open the border in 43 days?
We'll obviously consider everything, and there's more than lots of factors to consider, including when it's peaking in the east. So as I said to you the other week when we made the announcement, opening the border with no restrictions when they have tens and tens of thousands of cases per day in the east was unwise. And I think you'd have to be foolish not to understand that. It's unwise. It would have meant thousands of cases instantly seeded and huge increase in infection rates, absenteeism, sickness and death. And what we tried to do is avoid that whilst we get that third dose rate up.
It appears that the case numbers have peaked in the eastern states. So does that give you more confidence?
I've been hearing that for weeks. You guys have been reporting that for weeks. And what it does is it bumps along, and what you see is sometimes an increase in hospitalisation, sometimes an increase in ICU. I outlined all this to you last week in response to questions. On that day, the increase in hospitalisation in New South Wales went up, the ICU admissions went up, and various states increase in infection rates and sometimes a decrease in infection rates. So, look, you just got to watch these things over time and also watch the reporting rates. Sometimes the reporting rates aren't as strong as perhaps they should be. So we're just monitoring everything. We're not acting recklessly or foolishly. We're acting in a considered and reasonable way because we want to, the Government of Western Australia wants to, save lives in Western Australia and save jobs at the same time.
Can I just ask about sporting teams that are currently working towards a fly-in, fly-out model? For example, Adelaide comes in on Friday night to play on Saturday, plays a game after being in hotel quarantine, then flies out. Is the fly-in, fly-out model something that's been worked on, and can you give any more details on that?
We've worked on this for the last 2 years. We've made it work each year in a very, very safe way. And you might recall Western Australia saved the AFL season last year. We saved the AFL. Great grand final, held with a full crowd, in a very safe environment, very safe way. We'll continue to work on those measures with sporting codes.
So somehow we bring on team families and fly in, fly out, like you do a separation thing now.
Look,
AFL teams
yeah. Over the course of the last 2 years, we've worked through these things with bubbles and quarantine arrangements. That's what we put in place. That's the discussions we'll continue to have. But if sporting codes don't want to adhere to the rules we put in place, for instance, cricket didn't want to, so we didn't hold the Ashes test here in January, well, that's a decision for them.
What can government do to help prevent these unacceptable behaviours? I'm sure you're aware of the reporting to sexual harassment in the workplace.
We talking about COVID or something else?
Something else, I'm sorry.
The Rio Tinto report? Look, we've employed a huge number of additional WorkSafe inspectors. We've better resourced the Department of Mines, Industry and Regulation. And obviously we're putting in place campaigns and monitoring around these things. Obviously these reports are always very disturbing. Working in the mining industry, particularly a long way from family and friends, is an isolating experience. It shouldn't be made worse by poor practices and poor behaviours. And I'd urge every company to make sure they are on top of these sorts of things to prevent them occurring again.
So for 54 staff at that school and 27 students for 14 days, that is so many people going into quarantine. That is not sustainable. And what have you got to say to parents at that school?
Look, it's an unfortunate situation, obviously, and we'll obviously get staff back in to make sure the remainder of the kids are properly taught and the school can continue to function. Obviously it's very sad for those people involved. I just make the point to you that in other states, hundreds and thousands of schools have closed for months on end. That has not occurred in WA.
When you said this just before, you said it won't be far away. Were you referring to the new rules or just the isolation period, specifically 14 to 17?
No, the new rules. So the new rules, they're obviously not far away, but as I outlined to you last week, there's a range of factors involved. Obviously, we're getting, 20 or so cases a day, and we've got to up our testing regime, and we'd like more people to get tested, but it's not far away, but I can't put a specific date on it. But I just remind you, the new rules are less safe than the existing rules. Everyone needs to understand that, because I think there's a lot of misunderstanding. The new rules are less safe than the existing rules, and we have avoided the huge dislocation that has gone on in the eastern states over the course of the last 2 years, economic dislocation and large numbers of death, because we have been cautious.
So the Chief Health Officer wake up one morning and then see the figures of the number of COVID cases they are.
I've been through these sorts of questions for the last 2 years, virtually every day. And what we've always done is taken a considered and cautious approach to what works in the West Australian context. And so far, what we've done has worked. And what we've done is saved thousands of lives and many thousands of jobs. And that's the approach we will continue to adopt.
Is it 1,000 infections, or is it 2,000 infections, or 3,000 infections?
I answered those questions last week.
The fact actually is we're quick to explain how this works, don't be worried about it.
It is complex, I admit that, and I just encourage people either to use this sort of information or get help. And there are people out there who will help you. For instance, my 16-year-old helped me, and that's what people are doing. You're seeking assistance to ensure that you can do it. So I realise these things are complex and difficult. Modern age is like that, but if you need help, please seek it.
Sorry, can I just one on COVID just quickly? With the flood in South Australia interrupting supply chains, there are some businesses in Western Australia who are calling on some government support. It's an unusual situation where a natural disaster in another state is impacting supply here. Is there anything that you can do? Is there any considerations or grants that can be given to these businesses?
Who's asking for that?
An independent food distributors Australia has asked for some consideration to be made by the government about whether grants and
Look, that's not on our agenda. The most important thing is what we can do is make sure we can continue to supply products and food to West Australians. I just urge people not to panic buy. Make sure you only use what you need. We're organising arrangements to get food in. Look, we can't control a flood in South Australia that cuts a rail line that is regulated by the Commonwealth Government. But what we are doing is doing everything we can in conjunction with the Commonwealth Government to get as many supplies in place. This will last a matter of weeks, we expect, and what we want to do is make sure that we continue to get as many supplies as we can in. Floods and cyclones are part of the Australian environment, and obviously this was not really something foreseeable, considering it's apparently a 1 in 200 year event, uncontrollable, but we're doing everything we can to get supplies into WA.
Premier, how do you respond to the businesses that are calling radio saying they've been either listed on the exposure site website when they haven't even been exposure sites, or had been listed with wrong dates and things? A gym calling yesterday, it was listed during that time. We had another restaurant site, Cutting Water in, who weren't even exposure site on the list without even knowing.
Well, we correct these things if there's a mistake made, and bear in mind that the staff are working very hard to keep a track of all this and keep everyone safe. If there's a mistake made, the mistake will be repaired and corrected as soon as possible.
Thank you, everyone.
Thank you.